Hello, it's Dr. Rhonda Johnson. Today is Monday, January 4th, 2021, and today I'm going to be discussing COVID-19 disease in children and teens and talking about how this pandemic has affected children. Well, according to a statement published by the American Academy of Pediatrics on January 29th of last year, more than 2 million children have been diagnosed with COVID-19, and more than 1 million of these infections have occurred since mid-November. So this current surge of surges that we're in is impacting America's children. In last week alone, 179,000 cases of COVID-19 were diagnosed in children. Now, children make up 12.4% of the total cases in the U.S., but again, the American Academy of Pediatrics stated that under testing is common in children, and they believe the number of children who have COVID-19 are much higher. Now, only 179 children and teens have died from COVID-19 here in the United States as of today. But sadly, 78% of these deaths were in Black and Hispanic children. So I thought I would go over and review the symptoms of COVID-19 in children. Now, most children have no symptoms or they have mild symptoms. But again, some children can get severely ill, end up in the hospital, and need advanced medical care. So symptoms can look like symptoms in adults, and they can mimic other illnesses such as the common cold or strep throat or the flu or even allergies. So remember, children 6 months and older should have their flu shot and to, decrease their chances of getting the flu. So the symptoms of COVID-19 include cough, nasal congestion, runny nose, fever, chills, a new loss of taste or loss of smell, sore throat, shortness of breath, difficulty breathing, diarrhea, nausea or vomiting, stomach ache, feeling tired, having a headache, muscle aches or body aches, or poor appetite or poor feeding, especially in babies and toddlers. Now, what groups of children are at higher risk for complications of this COVID-19 infection? Well, certainly babies who are under a year of age, and certainly any baby that has been premature and has complications of prematurity are at a higher risk of complications from COVID-19. Other children, regardless of age, if they have underlying chronic medical conditions, they may be at increased risk of complications. Children with asthma or chronic lung disease or prematurity, diabetes, any child that was born with a genetic or neurological condition or a metabolic condition, children with sickle cell disease, children with heart disease, children who have had cancer and who are immunosuppressed, children with HIV/AIDS, and children who have medical complexity. These are children who need various technology support to live, like a tracheostomy or ventilator or a G-tube. Children with technology are at a much higher risk because they need these things to stay alive. Also, children who are very overweight and obese, just like obese adults, are at higher risk for COVID-19. So if your child has one of those conditions or teen, it's really important to have a regular relationship with a primary care provider and consult your child's doctor if they show any symptoms of COVID-19. Now, there is a rare complication from COVID-19. It's called MultiSystem Inflammatory Syndrome, MISC. It's a condition where various body parts can become highly inflamed, including the heart, the lungs, the kidneys, the brain, skin, the eyes, or gastrointestinal organs. Experts do not know what causes this MISC, but it is related to COVID-19 infection. Now, sometimes MISC can be serious, life-threatening, and even deadly. So it's important that children with this condition be diagnosed and treated early. Now, symptoms of MISC include fever, abdominal pain, vomiting, diarrhea, neck pain, a rash, which is often red and occurs on the palms of the hands and the soles of the feet. Bloodshot eyes is particularly common in MISC, and feeling extra tired. So again, your child can have, or teen can have these symptoms or have no symptoms. So it's important to know about it, and of course, consider this a medical emergency for your child. Now, children have suffered enormously during this pandemic, even if they haven't contracted the virus. Many children are struggling with the upheaval in their daily lives, the social isolation, and anxiety about getting sick or watching their parents get sick. So disruptions to their education have impacted their academic learning and their academic progress. And this is especially true for children who live in poverty. Many children are hungry because of the disruption in their parents' means to buy food for them. And many children aren't getting their routine immunizations, getting their well child visits, and their dental services. So children have been greatly impacted by this pandemic, just like adults. So with this message, I hope you've learned more about the symptoms of COVID-19. Like an adult who can be cared for at home, treatment is supportive. So make sure that you have the things that your child will need, and make sure that you can isolate your children from their caregivers should they be sick with COVID-19. Remember, if someone in your child's school or sports team tests positive for COVID-19, you need to have your child tested. Please consult with your healthcare provider, and you also need to quarantine while you're waiting for the test results to come back. Now, folks, I also want to just give a plug for this COVID-19 vaccine. It hasn't been tested yet in children. Pfizer is doing trials on children who are 12. The Pfizer vaccine can be given to children or to teens 16 and up. But the way out of this pandemic, folks, is the COVID-19 vaccine. So I hope that you are evaluating your decision, making your mind up, getting information, listening to the science and the facts, and not the misinformation. And so when your turn comes up in the line, you can get your vaccine. This is Dr. Rhonda Johnson. My views are my own. They're only intended to help save lives. They should not be considered medical advice or a substitute to getting information from your personal healthcare provider. So stay safe and have a blessed day.